Think beating diabetes is just about cutting carbs? There's more to it. Certain vitamins can help lower blood sugar, boost insulin function, and protect against complications, naturally. In this video, discover 5 powerful nutrients that could transform your diabetes journey. Don't miss number 2. It might surprise you. Vitamin number 5, vitamin D. Vitamin D isn't just for your bones. It plays a major role in blood sugar regulation and immune support, especially for people with diabetes. This fat-soluble vitamin helps your pancreas produce insulin and also improves how your cells respond to it, making it easier for glucose to enter your cells instead of building up in your bloodstream. But that's not all. Vitamin D also helps reduce inflammation, which is a key driver of insulin resistance and many diabetic complications. Chronic inflammation can silently damage blood vessels, nerves, and organs over time, and low vitamin D levels may make it worse. By keeping your vitamin D in a healthy range, you're supporting both your metabolic health and your body's natural defense systems. Surprisingly, many people with diabetes are deficient in vitamin D without even realizing it. This is especially true if you live in a place with limited sunlight, spend most of your time indoors, have darker skin, or are overweight. All common risk factors for deficiency. Since your body makes vitamin D from sunlight, lack of exposure can lead to low levels, even if your diet is decent. Low vitamin D has been linked to higher blood sugar, increased insulin resistance, and a greater risk of type 2 diabetes. That's why testing your levels and supplementing if needed can be a game changer. Whether you get it from sunshine, fortified foods, or a daily supplement, making sure you have enough vitamin D could help you manage diabetes more effectively and prevent long-term complications down the road. Vitamin number 4, magnesium. Magnesium is one of the most essential yet underrated minerals when it comes to managing diabetes. It plays a central role in over 300 biochemical reactions in the body, including the crucial process of moving glucose from your bloodstream into your cells. Without enough magnesium, your body struggles to use insulin effectively, which can lead to higher blood sugar levels and eventually insulin resistance. Studies show that people with low magnesium levels are more likely to develop type 2 diabetes. Even if you already have diabetes, a deficiency can make it harder to keep your blood sugar stable. That's because magnesium helps your insulin receptors function properly, allowing sugar to leave the bloodstream and enter your cells for energy. When magnesium is low, this process becomes sluggish and inefficient. Unfortunately, magnesium deficiency is common, especially in people with diabetes. High blood sugar and frequent urination can cause your body to flush out more magnesium than normal. This creates a cycle where low magnesium worsens blood sugar control, and poor control lowers magnesium even further. You can get magnesium naturally from foods like spinach, almonds, pumpkin seeds, black beans, and avocado. But depending on your diet, age, and how your body absorbs nutrients, you might not be getting enough. In that case, a high-quality magnesium supplement can help fill the gap. Look for forms like magnesium glycinate or citrate for better absorption. Adding more magnesium to your routine can support better blood sugar balance, improve energy, reduce cramps, and even ease stress. It's a small addition that can make a big difference. Vitamin number 3, vitamin B12. Vitamin B12 is absolutely essential for anyone managing diabetes, especially if you're taking metformin. This powerful vitamin supports nerve health, red blood cell production, and brain function. But here's the catch. Many diabetics are unknowingly deficient, and that deficiency can lead to serious complications. One of the biggest concerns for diabetics is neuropathy, nerve damage that causes tingling, numbness, or even pain in the hands and feet. B12 plays a key role in maintaining healthy nerves. Without enough of it, nerve damage can progress silently and become irreversible over time. Metformin, one of the most commonly prescribed medications for type 2 diabetes, has a well-documented side effect. It reduces your body's ability to absorb vitamin B12. So while the medication helps lower your blood sugar, it might be depleting a vitamin that's protecting your nerves. This makes regular monitoring of B12 levels incredibly important if you're on long-term metformin therapy. Vitamin B12 also helps in the formation of red blood cells and supports overall energy levels. A deficiency can leave you feeling fatigued, mentally foggy, or even depressed, symptoms that are often mistaken for stress or poor sleep. You can get B12 from animal-based foods like meat, eggs, dairy, and fish. But if you're vegan, vegetarian, or over 50, your absorption may already be reduced. In these cases, a B12 supplement, especially in the form of methylcobalamin, is often recommended for better absorption and nerve support. If you have diabetes and experience tingling, weakness, or unusual fatigue, don't ignore it. Boosting your B12 could make a big difference in your energy, your nerves, and your long-term health. Vitamin number 2, alpha-lipoic acid, ALA. Alpha-lipoic acid, or ALA, is a potent antioxidant that stands out for its impressive benefits in diabetes management. Unlike most vitamins, ALA works in both water and fat environments in the body, making it uniquely powerful in fighting oxidative stress, a major contributor to diabetic complications. One of ALA's most remarkable abilities is improving insulin sensitivity. When your cells respond better to insulin, your blood sugar levels stay more stable throughout the day. That's a huge win for anyone trying to keep diabetes under control naturally. But ALA doesn't stop there. It's also known for reducing nerve pain. If you suffer from burning, tingling, or numbness in your hands or feet, ALA may help ease those symptoms. In fact, it's used in several countries as a treatment for diabetic neuropathy. Studies have shown that regular use of ALA supplements can improve symptoms of nerve damage and even slow its progression. Research has also linked ALA to modest reductions in blood sugar levels. Some studies report a decrease in fasting glucose and improved markers of inflammation in people with type 2 diabetes. That makes ALA a great add-on support for your existing treatment, though it's not a substitute for medications or lifestyle changes. While your body produces small amounts of ALA naturally, the therapeutic benefits come from higher doses, usually available in supplement form. It's difficult to get enough through food alone, though small amounts can be found in spinach, broccoli, and organ meats. If you're struggling with blood sugar spikes or nerve discomfort, talk to your doctor about trying ALA. When taken consistently, it might just become one of your most valuable tools in managing diabetes. Vitamin number 1, vitamin C. Vitamin C might not be the first nutrient that comes to mind when you think about diabetes, but it absolutely deserves a spot on your daily checklist. This powerful antioxidant does more than just support your immune system. It plays a vital role in protecting your blood vessels, lowering blood sugar, and fighting the long-term damage caused by high glucose levels. Studies have shown that taking vitamin C can help reduce fasting blood sugar, especially in people with type 2 diabetes. It also helps lower markers of inflammation and oxidative stress, two major contributors to complications like heart disease, kidney problems, and vision loss. One of the most important ways vitamin C helps is by strengthening blood vessels. Diabetes can weaken the walls of your veins and arteries, increasing the risk of poor circulation and damage to vital organs. Vitamin C supports collagen production and vascular health, helping to keep those blood vessels strong and resilient. Vitamin C also plays a direct role in glucose metabolism. It can reduce sorbitol accumulation, a sugar alcohol that builds up in cells and causes damage in diabetics. On top of that, it's been shown to support better overall insulin sensitivity. You can get vitamin C naturally from foods like oranges, lemons, bell peppers, strawberries, and broccoli. But if your diet is lacking or if you need a stronger dose, a high-quality supplement may be helpful. Because it's water-soluble, your body doesn't store excess vitamin C, so it's important to get a steady daily supply. Whether through diet or supplements, this vitamin is one of the simplest ways to protect yourself from the inside out. How to add these to your routine. Adding these powerful vitamins to your daily routine doesn't have to be complicated, but doing it the right way can make all the difference. Start by focusing on whole food sources. Leafy greens, nuts, seeds, citrus fruits, lean proteins, and colorful vegetables are packed with many of these nutrients. For example, spinach and almonds are great for magnesium, while oranges and bell peppers are loaded with vitamin C. A balanced, nutrient-dense diet should always be your foundation. However, food alone may not always be enough, especially if you're dealing with absorption issues or taking medications like metformin, which can deplete nutrients like B12. In those cases, high-quality supplements can help bridge the gap. For best absorption, timing matters. Fat-soluble vitamins like vitamin D and ALA are better absorbed with meals containing healthy fats. Water-soluble vitamins like C and B12 are typically best taken on an empty stomach or with a light meal. Magnesium is often best taken in the evening, as it may support relaxation and sleep. If you're taking multiple supplements, try to space them out throughout the day to reduce digestive discomfort and maximize absorption. And always read the labels. Some combinations, like calcium and magnesium, can compete with each other if taken together in high doses. Most importantly, consult your healthcare provider before adding any new supplements, especially if you're on medications or managing other conditions. What works for one person may not work for another. With a thoughtful approach, these vitamins can become a powerful, natural ally in your fight against diabetes. Conclusion: these 5 vitamins may offer powerful support on your path to better blood sugar control. They're simple, natural tools, but they can make a big impact when used consistently and wisely. Have you tried any of them? Share your experience in the comments. I'd love to hear what's worked for you. And if this video helped you, don't forget to like it and subscribe for more natural, science-backed ways to manage diabetes every day.